Hello everybody and welcome to the Thursday edition of Video Clips. I'm often asked about the role of alcohol in a program of dietary excellence, and just for the record, I'm not a teetotaler, and I don't recommend that most people completely abstain, the obvious exceptions being alcoholics and people with serious health issues. But alcohol is a treat. It shouldn't be part of the daily fare. And this actually ends up being contrary to the advice of many experts who claim that wine drinking promotes better health, and advocates of the Mediterranean diet who insist that the reason why Europeans are healthier is because they drink wine. And by the way, Europeans, as it turns out, aren't much healthier than Americans these days. I covered that in a few previous video clips. So in any case, what does the evidence show? A very well-researched article on this topic was posted on Medscape, and the article is extraordinarily long. I'm just going to extract a few key points that I think might be helpful in understanding the issue. Now, I'll start with saying that one very popular piece of advice is that everything is okay in moderation. The advice works for people because it basically allows them to eat and drink anything, and it's okay. But as it pertains to alcohol, according to the 2014 World Cancer Report issued by the World Health Organization, International Agency for Research on Cancer, no amount of alcohol is safe. The IARC labeled alcohol as a carcinogen in 1988, and has stated since then that the effect is dose dependent. Your risk gets higher as you drink more. A cause and effect relationship has been made between alcohol and cancers of the mouth, larynx, esophagus, colon, rectum, liver, female breast, and pancreas. Links have also been made between alcohol and leukemia, multiple myeloma, cervical cancer, and cancers of the vulva, vagina, and skin. But the article says more studies are needed to confirm this relationship. Studies have even shown that light drinking increases risks, but there are some issues with the data on drinking. First, most studies have used self-reported data, which can skew results considerably. And I've mentioned this many times when reviewing studies on dietary patterns, that studies have consistently shown that people underreport their bad habits and they overreport their good habits. So they're highly likely to say that they don't drink as much as they do and they eat a whole lot more vegetables than they do. So what this means is that drinkers labeled as moderate drinkers in some of these studies might actually have been consuming a whole lot more alcohol than they owned up to. And of course, there are no studies, and I've looked for them actually, that have examined outcomes for people who eat something like a well-structured, low-fat, plant-based diet who are light or moderate drinkers. Now, I don't want to imply that eating a plant-based diet is a free pass to just have as much alcohol as you want, but eating a diet that is made up of a lot of cancer-fighting foods might offer more protection for people than those who eat the standard American diet would enjoy. Now, one reason to believe that plant-based diets might offer some protection is that the mechanism of action for alcohol and cancer is carcinogenic compounds that are in alcoholic beverages. And these include things like acrylamide, aflatoxin, arsenic, benzene, cadmium, ethanol, formaldehyde, and lead. Now, numerous studies, and I want you to think about Dr. Campbell's research at Cornell, population studies, numerous studies have shown that exposure to chemicals is less important than dietary cancer promoters in determining the risk for cancer. So there actually may be reason to believe that a low-fat, plant-based diet would result in lower cancer risk for people who drink than a more carnivorous diet. But the reality is we don't know, so I think it's wise to be cautious. What we do know is that alcohol increases estrogen levels, which is a risk factor for breast cancer, and alcohol also increases the activity of insulin-like growth factor, which can stimulate cancer cell proliferation. The type of alcohol doesn't matter. A lot of times you hear people saying, well, if it's red wine, it's better than white wine or beer. It really doesn't matter. And for many types of cancer, it really is the type of tissue, the part of the body that's exposed to the alcoholic beverages, like the mouth, the esophagus, stomach, colon, and rectum. The Medscape article did address, and I love this, the myth that alcohol is cardioprotective. The misunderstanding, according to the author, was media coverage of the supposed French paradox, which stressed that light to moderate alcohol intake actually reduced the risk of cardiovascular disease. Observational studies, which can be misleading, showed that the French, who were the biggest drinkers of all, actually had lower heart attack and stroke risks. But the author says, enthusiasm for wine drinking ignored the small print that advised against taking up drinking because of the other conditions to which drinking would lead, like cancer. The evidence showed harm from alcohol consumption outweighs the benefit from consuming it. Now, as you might imagine, the article included some commentary about how clinicians should approach patients about alcohol consumption, and I'm not surprised at this. They didn't really recommend abstinence except for people who have a serious drinking problem, as I mentioned earlier. Recommendations included alcohol screening and interventions to reduce intake, and intervention can be effective. Warning labels were suggested. I'm not crazy about that. First of all, there are warning labels on alcohol now, but studies have shown that labels don't really do a whole lot to change buying and consumption habits, so I'm not sure we ought to be wasting time on it. The proposal to increase taxation, well, alcohol is pretty well taxed and regulated now, and I don't think it's done much for curbing consumption. All of them advocated discussions with patients about alcohol. I think that's a good idea. Some suggested guidelines that advise against binge drinking and episodic drinking. Now, personally, I think that most people know binge drinking is not a good idea. I don't think an education program is really needed. And for people who are binge drinkers, it's usually because they're addicted to alcohol or they have an unhealthy relationship with alcohol, and I don't think educational programs help them very much either. So my recommendation is this. I think the first thing is that we've got to get doctors to stop talking about the benefits of alcohol consumption. I mean, we have new members coming in here all the time who say that their doctors have told them to drink. I mean, it's hard to believe. And then one of the best-selling books in the country right now about diet, this doctor tells people to drink red wine every day. No wonder he sells a whole lot more books than I sell food over medicine. He gives people lots of good news about their bad habits. And then my second recommendation is to be really clear about where alcohol belongs in the scheme of things. Typical guidelines that are issued by the government and health organizations use terms like, drink less or use sparingly. Nobody knows what that means, and interpretation is so highly subjective. So let's place alcohol in the same category as birthday cake and Christmas cookies and Valentine's chocolate. It's for special occasions, not for daily consumption or every night with dinner. So I hope that clarifies it. And again, I'm not striving for dietary perfection myself, nor am I trying to recommend that to others. I think it's an unhealthy and unrealistic standard, but I think it is important to put these things in perspective and to make sure that we're not over consuming some of these things and not listening to some of that background noise, the good news about bad habits, that we're all a little susceptible to that type of message. So anyway, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back with you again on Tuesday.